All right, hi everyone. Thank you guys for coming today. Representative is in the building. I just wanted to brief you guys on the itinerary for the evening. We are going to have a brief introduction by myself, followed by Representative Ellison speaking. We will then have the panelist discussion, which will be moderated by Dean Finnegan, and then we will have an audience Q&A. There are note cards in the front, and Jane's got them in the back there. And you can feel free to write your questions on the note card. Someone will come and pick them up, and then they will be read to the panelists. All right. So on behalf of the Active Response Coalition for Public Health and the School of Public Health, I would like to welcome you to this forum on gun violence and policy. My name is Samantha Lambic, and I'm a representative for ARC and a first-year health policy and administration graduate student here at the University of Minnesota. ARC of Public Health is a student-led organization that seeks to inform and mobilize community members to engage in important conversations regarding emergent public health crises. We strive to foster an environment that supports individuals in their ability to make a difference in their community through immediate and targeted responses. We've chosen to address the topic of gun violence as a public health issue because we have all been victims of gun violence. For those of us who have not been directly affected, we can be assured that someone within our immediate circle has. Within our community and those across the nation, we are seeing divide among constituents regarding this issue, weakening our potential power of collective action. We recognize that this issue has not come to fruition overnight and is the result of many different factors, including but not limited to sociocultural acceptability, legislative policies, economics, historical precedent, among many, many others. But we believe in the possibility of a common solution that benefits the quality of life for all of us. Recent media attention aside, this is truly at the heart of why we believe this conversation is necessary. We are thankful to be hosting panelist members today with incredibly unique perspectives. We have welcomed them here to share their understanding and various experiences with gun violence policies. We acknowledge that their voices are not and cannot be entirely representative of those who are working on and have been impacted by this issue. However, we believe their thoughts can provide a solid starting foundation upon which we can further shape our own perspectives and seek to change the future of guns in our community and their impact on future generations. With great excitement and honor, I would like to introduce Congressman Keith Ellison, a man who has devoted his life and legislative work toward achieving equity for those residing in the diverse and thriving 5th District.
Sam, thanks a lot. We're now in the School of Public Health. And because of the public nature of the work you do, I think it's important to impart to you what I think is a law of political science. This is a law of political science. Any issue, no matter how meritorious, no matter how important, no matter how urgent it is, any issue that does not have an active, organized constituency, no matter how more important it is not going anywhere. And any issue, no matter how frivolous, unimportant, or trite or trivial, which has an active, motivated, well-financed group, will move its agenda. You could take that and carve it into granite. Now, it's not true that the people who want sane, sensible gun laws are not organized. It's actually possible to be doing the right thing, but we need to do more of the right thing. And I can tell you that the real problem here is not, I'm all for more studying. It's absolutely crucial that we have the right research. I'm all for all of that, but the real problem is that literally billions are made from the Smith & Wesson, Winchester, Glock. Billions are made, and then millions are poured into an agency, a nonprofit organization, if you will, that spends all types of time and money lobbying, bullying, threatening, and bribing members of Congress to stop any progress, to stop ideas that just make basic common sense. Like, I don't know, background checks. This doesn't even interfere with your right to have a gun. It just says what they say, which is only the right people should have them. Okay, fine. Let's start with people on the no-fly list, perhaps. We couldn't even get them to do that. You're not safe enough to fly on an airplane, but you're safe enough to have a gun. See this stupid stuff that they won't even agree to. Or, you know, like I said, background checks. 90% of the American public believes we should have background checks, yet we can't get background checks through. Even after 27 children were murdered in Sandy Hook, we couldn't get background checks. Now, we had a huge outpouring right after Sandy Hook, and I thought we were really going to get somewhere. But then, when the vote came around, the outrage of the people who want sane, sensible gun rules had dissipated, and the people who are the gun absolutists had peaked at that moment. Critical votes. I can tell you, Senator Heitkamp, who was a critical vote in offering cloture to have that vote for background checks, said, well, I do come from a rural state where there's a lot of gun owners, and right the week before the vote, they flooded my office with calls to vote no, and the other people, I didn't hear from them as much. That's like an invitation to flood her office with calls next time. But don't doubt for a minute that this is not a political matter. And don't doubt for a minute that any outrageous gun crime is going to provoke Congress to act. If 27 little kids shot down isn't going to get you going, I don't know what will. If Gabby Giffords, a member of Congress, our colleague, who we sat next to every single day, shot in the face, and others of her company were killed, if that won't make a move, I don't know what's going to make a move. But I know this, the concerted effort of the American people will make them move. And so this event that you all are holding tonight, critically important. I don't want anybody in here to think, well, we didn't have a huge turnout. No, you had a successful event. Because if you talk to anybody, even one or two people, and turn them on to the need for sane, sensible gun laws, you have had a successful event. So don't trip on the numbers. I've been in meetings talking to 5,000 people, and none of them went out there and did nothing. They just cheered. And I've been in meetings with 5 people, and all of them went out and got busy organizing which one was more successful. You understand what I'm saying? I just want to say that we've got to teach, we've got to educate, we've got to work very hard to reach all the people that we can, but the most important thing to do is to galvanize the will of the people. And this problem is just like any other problem. It is solvable. It is within the lifetime of certain of us in this room when we remember it would be no big deal at all if somebody just light up a smoke right here in this auditorium. Am I right? Those of you guys my age don't have to admit it, but we know, right? Just get a smoke going right here in the auditorium. You young people, you'd be outraged if somebody did that, right? It used to be commonplace. Or people used to think it was funny to stumble around drunk. Oh, that guy's drunk. How funny that is. And then women against drunk driving, mothers against drunk driving, put it into that, mad. And I'm telling you that our day is coming up on this too. But we've simply got to do a few things. One is just talking about the carnage and the horror of places like Chicago, where they don't kill them in a mass number, but they just murder 1 or 2 or 3 at a time. 54 people in a weekend shot down in Chicago. Outrageous. But we've just got to keep on knocking on this door. And we've got to keep on dispelling the lies. No one is saying we're going to ban guns. It's a false statement. It's not true. We've got to dispel that. I can tell you, I was born in Detroit, but my whole family is from rural America, Louisiana and Georgia. I was shooting cans with a .22 when I was 5, 6 years old. I am handy with a shotgun, and I go turkey hunting. This is not the problem. Nobody's taking away my grandpa's shotgun. This is about military-style weapons. This is about 30-round clips. If you're going hunting with a 30-round clip and an AR-15, then you stink as a shooter. Seriously, you're not good. You need to quit. This is not about that. One shot, you go hunting with one shell. That'll be all you need if you're any good. So my point is that this is not about banning guns. There's things that we could and should do that are just smaller things that make sense. Do you know that they prohibited the Center for Disease Control from even studying gun violence? This is because you can't measure what you can't count, and you can't count it, then we don't really know. It's all anecdotes at that point. So that's something that's very important. That's in your wheelhouse as public health professionals. Also, what if you just said that you put fingerprint gun locks on every gun so that only the owner of that gun can shoot that gun? It would make it so that, but you know what, the gun lobby, they're against this, adamantly, vehemently. There are a whole lot of things that we can do and should do, and we're going to hear about more of them today, but I will say to you that your effort, your lobbying, your organizing, your knocking on doors, you're talking to as many people as you can is critically important. Do not discount the massive amounts of money involved in this situation. There are fortunes being made, and every time a big, ugly killing happens, there's a run on the gun store. And they like that. And then also, let me tell you that this cuts across every line. I can go to low-income black folks in North Minneapolis or Chicago. I can go high-income white folks in Coldwater, Minnesota. Or I can go to business owners. I can go to it hurts everyone. But what we are now is sort of a large, diffuse group upset about a serious problem, and we have got to combine ourselves into that instrument of political action that can bring about a good result. Because it may be true that a small group of highly organized people can overcome a large group of disorganized people, but it's also true that a large group of organized people will overcome a small group of organized people. And we have just got to tighten ourselves up so that we can win this battle. So bless everybody who helped pull this important event together. I do have some things that I'm double booked on. I'm going to stay for about 15 minutes. If I leave, don't think it's for lack of interest. I am 100% with you on this. And I want to commend you for pulling this forum together. And I'm actually trying to get a screening of a film called Making a Killing. And I'd like to partner with you guys to do that if you're interested. So bless you all, and thank you very much for this great work.
Thank you so much, Congressman. Really appreciate your comments and your experience in this. And I am, by the way, John Finnegan, if you haven't figured that out, and I'm Dean of the School of Public Health. And I really also want to commend, before we go on, our students from the Active Response Coalition for Public Health. I didn't put this together, they did. And they're going to be that next generation of public health professionals that's going to be out there in the community working on issues like this. So please, a round of applause for those students. So I want to introduce our panelists here, and I will work from my left, your right, to the other end, and I'll introduce each one, and then we're going to have a conversation among us about public health approaches from their various perspectives. So first of all, I want to introduce Judge William Koch, who has served as a 4th District Judicial Judge since 2007. He was appointed to the office by Governor Tim Pawlenty, and he is one of 8 judges assigned to the Felony Block Calendar Pilot Program, which is designed to improve the bench's overall timeliness and case management through disposition. So his contributions include work as a former Air Force JAG, private practice attorney, and a federal prosecutor with both criminal and civil experience. And seated next to him is Reverend Nancy Nord-Bence. She left parish ministry to devote herself to the prevention of gun violence. She is the new executive director of Protect Minnesota. And before her ordination to the Evangelical Lutheran Church of America, she served as the executive director of the Minnesota Religious Coalition for Reproductive Choice. Her particular expertise is in coalition building, She brings renewed dedication to working in partnership to combat the increasing incidence of gun violence and its devastating effects. And seated next to her is Sasha Cotton. And Sasha has served as the Youth Violence Prevention Coordinator at the Minnesota Department of Health since 2014. And her work has included overseeing and implementing the City of Minneapolis's blueprint for action to prevent youth violence, which is a comprehensive public health approach to addressing the challenge of youth violence. And this includes maintaining the city's status as a national forum on youth violence prevention site through the Department of Justice, as well as providing information and insight to city leaders and elected officials as it relates to youth violence. And on our far left here is Dr. Roger Feldman. And Roger is received his PhD in economics from the University of Rochester. He is one of our health economists here on the faculty of the School of Public Health. He is a regular contributor and referee of articles in many major professional journals, and no doubt you have seen his articles occasionally appear in the Minneapolis Star Tribune. He has also served as a consultant to the U.S. Department of Health and Human Services and the Congressional Budget Office. And in the mid-1980s, he served as senior staff economist for health policy and economics on the President's Council of Economic Advisors. And he now teaches advanced health economics at the University of Minnesota. Please welcome the panel. Well, I found it very interesting that, to start with, Congressman Ellison gave us a kind of a definition of public health. You know, we talk about public health as essentially organized activity, which is devoted toward changes that seek to improve health. And it's about prevention, and it's about health promotion. And each of you on this panel represents a different sector, shall we say, of our society. And when we come to deal with an issue and a challenge that is complex and as multi-layered as gun violence, it is not one thing, it really does require the organized activity of all kinds of sectors and all kinds of individuals as well. So I think maybe, if I might, I'll start with Bill Koch and ask, from your perspective, the role that you play with respect to the law and what you see going through your courtroom. What can you do, and how do you contribute to this challenge, Bill? I should say judge, by the way.
Bill's fine.
Okay.
Well, let me start with a disclaimer. I'm one of 62 judges in Hennepin County, and so I'm speaking for myself, not for the judicial branch or the other judges. I feel like I just need to put that out there. You know, I do have a felony block right now. Felony cases are those that the potential sentence could be a year or more. And so it's the more serious crimes that are out there. Gun cases we see, unfortunately, pretty regularly. I have murder cases, I have other felon in possession cases, assault cases involving a dangerous weapon, typically a gun or a knife. When we see people in the criminal justice system as judges, we're seeing folks at the end. I mean, it's something where there already has been a crime allegedly committed. And so what we're dealing with really are the defendants who are convicted if we're going to be sentencing them. And we're trying to fashion a sentence that's appropriate for the crime and for the individual. In Minnesota, I'm sorry, I don't know if I need to hold this differently. Hold it closer?
Hold it closer. Yeah.
Oh, okay. I was trying to reduce the feedback.
That's
okay.
his job.
Okay. Fair enough. In Minnesota, we do have sentencing guidelines that we use. There's actually a grid that we use that looks at the nature of the offense and then looks at the individual's criminal history, and it gives us an intersection, and that's the range that we're presumptively going to be sentencing someone to. For gun cases, there are mandatory sentencing provisions for most of them on the felony level, either 3 years or 5 years. As a judge, we are able to depart from that, typically down. To go up, we need jury findings and other things. But those are limited. And by the rules that we operate under in the sentencing guidelines, there have to be substantial and compelling reasons, that's the legal phrase, to depart from those sentencing guidelines. And what we have to help us with that is that we'll have a pre-sentencing report. That's completed by a probation officer who's met with the defendant, who's reviewed a whole host of history on the defendant, medical records, mental health records, chemical use records, employment, education. They talk to collateral contacts and all that, and we get a written report. And we can also obviously receive the input of victims. In Minnesota, there is a Victims' Rights Act, basically, and if you're a victim of a crime, you have a right to address the court at sentencing. We have individual victims who come in. We also have members from the community. If you're part of a community organization that's affected by a crime, you do have the right to address the court. Once we get all of that information, then we come up with what we think is an appropriate sentence. Sometimes people like our sentences, sometimes they don't. In about a third of our cases, there are departures in gun cases, so that the mandatory sentencing that's out there is not the sentence that's imposed. It may be that instead of sending someone to prison for 3 to 5 years, they get probation where they could go to jail for up to a year, and then they have a bunch of conditions that they have to satisfy. Typically, it's a mental health issue or a chemical dependency issue that needs to be addressed, and that can be done more effectively in the community rather than incarcerated. And the thought in that situation just generally is that it helps public safety in the future if you can address the underlying causes that's bringing them in, as opposed to just warehouse someone for 3 years or so, and then they're out with the same issues. So we're trying to take a kind of a holistic approach to things, but I don't want to.
No, that's
probably
good.
longer than you wanted.
That's a good start. And while Judge Koch sees a lot of, you see a lot of people after the violence has occurred, and you're dealing with that in terms of what they're going to do in the future. Pastor Bence is working at the other end, upstream, if you will, to try to do prevention. So from your standpoint, and I realize you're new to the position, Pastor, but from your standpoint, what are the kinds of policies or the kinds of approaches that you're using in Protect Minnesota?
Well, there are 2 issues right now that are being held in committee at the legislature that we're very interested in. One is we have loopholes in Minnesota law around criminal background checks. 82% of Minnesotans strongly favor criminal background checks before every gun purchase. 74% of NRA members support background checks, and yet we in Minnesota allow people to purchase guns from non-licensed sellers at gun shows and online. And often you hear the other side saying, oh, that's, Grandpa passing down his hunting rifle. No, this is really big business. These unlicensed sellers are moving hundreds of thousands of dollars of merchandise a year online. There's one site called armslist.com that sells something like 25,000 guns a year. If you think about it, nationally, they believe that 40% of all guns are purchased without a background check. Unfortunately, we can't figure out if that's true in Minnesota because it's the second thing I'd like to change. It is illegal in Minnesota to study the issue of gun violence. Our government agencies cannot collect data on gun violence and gun deaths in Minnesota. And so here we're at a public health forum. We want to talk about gun violence from the point of view of public health, and we can't do that very first thing, which is look at the data and see what it shows. So
Congress has passed similar laws.
Congress has passed similar laws to that as well. And so those are 2 areas I would really like to see us look at, that prohibitive language around studying the issue, which I don't think most Minnesotans are even aware of. And then thirdly, We at this time do not have gun violence protection orders. So if Judge Koch here, who looks like a great upstanding kind of guy, but if he were acting in a way that frightened his family, that made them concerned that he might do harm to himself or others, we have to remember that 80% of gun deaths in Minnesota are suicides. So we have to think about that. And if he were acting in a way that scared us, we would have no legal means of getting a protection order so that we could remove his weapons from the home. And so if we could close those loopholes in the criminal background check laws, if we could get gun violence protection orders, and if we could freely study the issue, I think we'd be well on our way to making a big difference.
So, Pastor, this is really a very important point because, you know, the first step in a public health approach to any problem is data, evidence, surveillance, for example, so that you can define what that problem is. And essentially what you're saying is that we have public policy that ties one hand behind our back, and we're not able to do that using the government agencies that we have. Now, private folks can do it, or NGOs,
Exactly.
or things of that kind.
Yeah, and so we know that 82% of gun deaths in Minnesota are suicides, but we know that because private doctors have gotten so exercised about this that they've put together the research.
Yeah.
And you'll hear opponents say, oh, that's the first step, it's the gun registry, and then they're going to come in and grab our guns. I loved what Congressman Ellison said. We just have to say no to the lies. We just have to say, no, that's not true. We have to be able to study gun violence in order to prevent it.
Well, let me move to Sasha Conton, and Sasha is part of the health department, and as I introduced her, the health department has a role in all public health problems. Sasha, could you talk a little bit about how the health department approaches this challenge?
So at the Minneapolis Health Department, we are uniquely focused on youth violence prevention and using the public health approach to address that issue. And we do that by using our Blueprint for Action to Prevent Youth Violence, which is the comprehensive plan that was mentioned before. Having the plan housed in public health is a unique opportunity we have in Minneapolis. Of the 15 cities that are a part of the National Forum with the Department of Justice, only 3 of them use a public health approach. And we sincerely believe in Minneapolis that by doing that, we're able to look both at prevention, intervention, and sort of reentry and enforcement issues as well by taking that public health stance versus a pure enforcement or a pure community-based even approach. That by partnering with other agencies through public health, we're really able to get better buy-in. And so our agency at the health department is able to work across sectors, not only in the community, but with our health department staff, and then also with departments within the city in order to look at policy, but also to provide programming on the ground. So some of the things that we're doing right now that I think particularly pertain to gun violence are hospital-based intervention with HCMC, and it's something that we've been working on for a very long time, but are very excited to be seeing it go into implementation this year. And it will allow us to partner with HCMC and to be able to provide services to young people who come in with gunshot wounds, to talk with them about that experience and provide them with community-based services to ensure that when they get back into the community, they have opportunities and choices to really think about the impact of that experience and hopefully be able to prevent it from happening again, because we know that when young people are impacted by gun violence, it's a great predictor that they will be impacted by gun violence again. And so we want to catch them at that moment where they may be well poised to make a change. So that is definitely one example of how we're using the public health approach, but we are not just doing that in a clinical setting. We are also really looking at social norms and working with young people on the ground to ensure that they're aware of the risk and protective factors for youth violence, and that they have the tools that they need in order to have a safe community and a safe outlet for that brain development issue that we know happens in youth. We want to make sure that they understand that they have a heightened risk just by being young, and particularly in our communities where violence is prevalent, that they understand how that exposure to violence may impact their judgment about the use of weapons and other bad decisions.
Thanks very much. And Roger Feldman, you're a health economist, and it seems to me that just about every major public health challenge we have in this country has some kind of an economic base to it. How do you look at this kind of a challenge of gun violence? And from an economist standpoint, what do you see going on?
Well, economists have a lot to contribute to the discussion. I think our main role is to assist the public policymakers in sorting out the evidence in an arena where we are lacking good data, which has been mentioned before, and we are lacking or sometimes even hamstrung from using the data that we have. I know we all have lots that we want to say tonight, so I'll illustrate that with just one instance. We don't know how many guns there are in the United States. It's estimated that there are about 300 million guns, more than one for every adult. But the only federal survey which tracked that data was discontinued in 2001. So one of my colleagues, an economist named Mark Duggan, had a bright idea that he would use the sales of a magazine called Guns and Ammo Magazine as a proxy for gun ownership. You know, sales of that magazine are heavy in areas which fit the demographics of gun owners. They're correlated with gun shows. So he said, I'm going to see if the sales of the Guns and Ammo magazine predict homicides. And he found out they did. So here we have evidence that's contributed by an economist using data that I would have never thought of to draw a connection between gun ownership and homicides.
Wow. You know, the other thing, and I'll open the floor here for anybody that wants to comment on this. When we talk about gun violence, we're naturally drawn to things like homicide and violent crimes and mass shootings that happened in Connecticut and places like that. And yet, Pastor Bence, you alluded to the fact that, in fact, one of the largest clusters of gun violence is actually not homicide, but suicide.
82%.
And so from a standpoint of prevention...
Well, it changes everything. I think we have been sold a line by the gun lobby that we all have to protect ourselves, arm ourselves, because the big danger is those people, you know, experiencing urban blight that are going to hurt us. And what we're finding over and over again is in Minnesota, the actual person who is most at risk of dying of gun violence is a middle-aged man in rural Minnesota who is suffering from depression. And so this is really a statewide issue. We see over and over again that once you get out into the outer suburbs and in rural Minnesota, you can't get an elected official from either party to vote for any common sense gun violence prevention measure because they're all about gun rights. And it's incumbent upon groups like my own to get out there into greater Minnesota and help them understand we're not talking about taking away your guns, but we do want to talk about suicide prevention. And we want to talk about the fact that the Johnson family suffered this terrible, terrible loss, and they knew that Harold was acting in a way that was a concern to them, but there was nothing they could do to remove the gun from his home. And if we'd passed this legislation, there would have been, and Harold Johnson could have gotten the help that he needed. We need to be able to make this about domestic abuse, which is also an aspect throughout the whole state. It isn't just in economically disadvantaged areas. And we need to be able to say that Mr. Johnson's wife was living in peril until there was this really great program that Anoka County created based on something that they learned about in Maryland that got her the help she needed when a police came to her door. And so to me, it's terribly important that we stop thinking about this as only being an urban problem, because we need the votes of the legislators throughout the state. And we're not going to get that if we can't get out into the state and talk to people about how gun violence belongs to everyone.
Okay, Roger Feldman.
I'm really glad this panel is also talking about suicides, because when we think of gun violence, we kind of automatically focus on homicides, but it has been pointed out that a majority of gun deaths are actually suicides, 60% nationally, and I guess more in Minnesota.
It's over 80%.
Back in the early 1980s, before the Brady law mandated waiting periods nationally, 18 states had already established mandatory waiting periods to purchase a gun. Then the Brady law made that mandatory for the whole country, but only for 5 years. One study looked at the states which passed the waiting period only when the Brady law made them do it, and looked at the effect of that policy. The result was a significant drop in suicide rates, which makes very good sense to me, because suicides are often thought of by people who really might stand some benefit from thinking about them and taking a little bit of time. And that's exactly what a waiting period made them do. And so if we're thinking about a public health approach to suicide prevention, a national waiting period would be something I'd recommend.
And it does underscore, I think, the fact that our mental health system is so poor nationally, and it's something we struggle with in Minnesota. Judge Koch.
Well, I was going to pick up on the mental health component, maybe from a slightly different perspective. A lot of people, kind of lay people and people out on the street, if you go and talk to them, they're concerned about a mentally deranged person having a gun and going and committing violence. And that's just not been the experience that we've had in Minneapolis. I mean, more often than not, the mentally ill are victims of crime and not actually the perpetrators of crime. And if they are perpetrating crimes, it's more often than not, they're doing something to self-medicate because the prescription drugs are so expensive that street drugs are easier and cheaper to get. And so it's that whole kind of milieu that you're dealing with. I do think from a criminal justice perspective and from an elected official perspective, there seems to be a coalescing of support for mental health care and treatment and making more facilities available, more resources available, so you're not waiting months upon months to get in to see a mental health provider. In Hennepin County, we really do benefit from being the largest city in the state and having resources here from the city, from the county, to have more services available. But if I talk to my colleagues who are judges in greater Minnesota, they're just in awe of what we can do, whether it's through HCMC or Minneapolis Public Health or other services that they just don't have. You know, they have to drive 100 miles to the nearest mental health provider and things like that. And so they're struggling with a whole different set of demands. And that's something that I hope that legislators will think about. And when we get to gun violence, we talk about suicide and suicide prevention. That's where the mental health component, I think, comes in. And so that might be a common ground in approaching legislators about that. And if I could, just to respond to something the pastor said about gun violence prevention orders, or I forget the word, protection orders. We do have orders for protection. We have harassment restraining orders where people can come in, and if there is a threat that they can articulate, we can provide orders for protection. Obviously, it's a piece of paper, okay? I mean, there's a lot of faith that goes into that. It doesn't always directly relate to guns that someone might have, but we are legislated and mandated that with certain types of convictions, we have to issue orders that dictate that the individual, if they have a weapon, if they have a firearm, they need to turn that over either to a licensed federal firearm dealer or to the local police. And so that, we kind of have little notes that we have on our benches reminding us of those situations so we can issue those orders. So there are some protections in place, but it clearly isn't as all-inclusive.
We can't remove a gun from someone before they've committed the crime, and that's what this would enable us to do.
Sasha Cotton.
Well, as you were talking, Pastor, about the issues in rural Minnesota, it helped me to think about an issue that I was actually just interviewed about this week, which is the increase in suicides in young men of color right here in the Twin Cities. And so there's a study being done right here at the U, at the Humphrey Institute, in partnership with the State Health Department, that's focused on what looks like about a 25% increase in African American men under the age of 35 committing suicide. And I think as we think about the availability of guns and the impact of guns, we have to think of the trauma that that demographic really experiences, and that that there perhaps is a correlation between that and the increase in the suicide rate that we're seeing. So I thought that was worth mentioning.
And that's a really important point, because I think what you're saying is that the issues of gun violence, whether we're talking homicide or suicide, affect all of us, obviously, and every life is precious, but they do affect some communities in certain ways more than others. I know in the suicide that you mentioned, we also see that phenomenon among American Indian communities as well, which again underscores some of the challenges we have as far as the mental health issues. So last October, about October 15th or so, the New York Times columnist Nicholas Kristof had a fabulous column, and I think you can still get it online at the New York Times, but it was about a public health approach. We need a new approach to dealing with this challenge. And I was stunned, because I rarely see anybody in the media writing so eloquently as Nick Kristof did about this challenge. And one of the things he said in his column, and I'm quoting this, "A poll this year found that majorities, even of gun owners, favor universal background checks, tighter regulation of gun dealers, safe storage requirements in homes, and a 10-year prohibition on possessing guns for anyone convicted of domestic violence, assault, or similar offenses." So even gun owners are in favor of this. What's stopping the train?
I think, do you mind if I answer that? Or say
No,
something
I
to
don't
that?
mind at all.
I think we've done a truly terrible job of engaging gun owners in this discussion. Truly terrible job. We have really, and I've been in the gun violence prevention group for a month now, but I'm still going to take it on. We have screwed up in that. We have not communicated that we're not about removing guns. I think in the gun violence prevention community, we often make it sound like we hate guns, like we think just guns in general are bad. And when we do that, then we lose something like 47% of Minnesotans that own guns. And so I think what we need to do is start articulating that our concern is not owning a gun, our concern is the wrong people owning a gun, and our concern is how they could hurt other people. We have to talk about balancing the right to own a gun with the right to live safely and securely. And we have just failed in that message, I think.
That's a very good point. Bill?
Could I just to pick up a little bit about that, and obviously the public health perspective on this, there is a case out of the state of Florida. It went up to the 11th Circuit Court of Appeals recently, back in July. It's commonly referred to as Docs versus Glocks. I don't know if you all are familiar with that. But there was a push by the American Academy of Pediatrics to encourage their members to go out and talk proactively with their patients and their patients' families when they came in for medical care, to just say, they ask about smoking in the home, they ask about domestic violence in the home, and they said, we believe that it's appropriate as a public health issue to address with people in a private setting with a doctor, is there a gun available in the house? And they were looking at it from a suicide prevention issue primarily, but also a domestic violence issue. There were that was the push from the AAP. The state of Florida and a couple other states were looking at how to limit that. I cannot profess to have knowledge as to who was behind that or anything else, but there was legislation passed in the state of Florida which said that a doctor cannot ask about gun ownership. The medical community in large challenged that. They took it to court and said, you're violating our First Amendment rights to talk with our patients about this. We're not asking about criminal conduct. We're not the government. We're just individual practitioners who believe that this is a health issue. The 11th Circuit upheld basically the statute, and they said, no, you can't do it, because the statute does allow a doctor to ask a particular patient about guns in the home if there's a particular concern as to that patient. But they could not ask as general kind of keeping data, or to find out generally, what is it about gun ownership. But if they had a suicidal patient that they were seeing, then they could ask. The difficulty, of course, is that you can't really educate if you don't know. And so some of the doctors, I think, are doing more outreach and education and talking with, parents about childhood safety concerns, and that the number 2 killer of children is suicide. And I got that yesterday from NPR, so I'm assuming that's accurate. Okay. Something that Sasha was mentioning about getting out to kids, I don't want to say kids, young people who are involved in gun violence, and trying to reach them in the hospital or reach them early to talk with them about the experience. While that might seem kind of mansy-pansy, or it's like a little too nice or something, and it's not going to get results, I think it could get results. There was another report. I don't get all my news from NPR, but I do trust NPR. But there was, a study done, or work that's being done in the city of Richmond, California, where they're working with gang members and others who are coming up in very violent situations, and actually paying them a stipend of $1,000 a month. As long as they meet certain requirements, and that means meeting with mentors and doing things like that, getting their GED if they don't have that. And what they've found is it's not paying, criminals for crime, kind of thing, but it's actually reducing the attraction that people have. And it's a maturity issue. It's, they kind of age out of some things, or they say, as a 12-year-old, I saw something and I thought that was cool and I acted in that way. As a 15-year-old, maybe I'm a little more discerning. As a 19-year-old, I'm definitely more discerning. As a 24-year-old, I get it, hopefully. And so it's early intervention, it's alternative dispute resolution, it's kind of monitoring and measuring things so that people can act on, an educated knowledge base, as opposed to kind of an emotional fear base.
If I can just add, I'm a convert from the criminal justice system. So I'm a previous probation officer and did a ton of enforcement in the beginning of my career, and have since moved into public health because we really do see that opportunity to do the prevention piece, and to really look at the social norms that condition us to choosing violence and to being perpetrators or victims, and really moving the dial upstream. And so, I think that there's definitely a place for enforcement, but I also really appreciate that you, from the bench, can see the value in a public health approach too.
If I could, we have our typical CJE, we call it, but continuing judicial education, and we have presentations on things like this. One of the areas that I find fascinating, and it might be something that research can go into the gun violence issue, but it just is the effect of stress and trauma on children, and kind of the fight or flight and other concepts. And it's something that I think judges, we are at the end of the stream, but our decisions dealing with individual defendants can make an impact not only on that defendant, but on the people around them. And I think we need to kind of own that. And I think to the extent that the mental health professionals, the public health professionals, and others can help educate the bench about these important issues, we'll all be better served.
So, Roger, I want to come back to something that Nick Kristof said in his column last year, and it had to do with, I suppose, what you might call design issues with respect to firearms. And the parallel is that we've done an enormous amount in this country in redesigning our roads, in redesigning automobiles, and the whole idea is that you're trying to make automobiles and roads as people-proof as possible. We even now have reached a point where your car, or some of the cars, will actually, if you don't see the guy in front of you suddenly stopping, your car does, and your car is always vigilant and never loses attention, and your car will stop. Are there things from the standpoint of the manufacture of these products, and I realize we have had some laws passed that prevent us from holding gun manufacturers responsible under the Consumer Safety Protection Act, but there would seem to me to be a whole bunch of things you could do with firearms in redesigning them that would have a real primary preventive effect.
Certainly, John. Unlike cigarettes, guns can be used safely. And so if we took a public health approach to gun safety, we would try to figure out how to do that better than we're doing it now. Unfortunately, the gun industry in the U.S. is so lightly and loosely regulated that we don't have anything that we could think of as a control group and an experimental group to compare. So I would suggest that the best place to look is elsewhere, meaning overseas. And I know that people in the United States are not going to listen if we talk about Sweden or England, because they think those places are just hopelessly socialistic already. But there is a comparison group that we could look at, and that is other advanced English-speaking frontier countries, namely Canada, Australia, and New Zealand. If you compare overall crime rates in those countries with the crime rate in the United States, we are safer. We're safer than Canada, guys. Interesting. Overall. Yeah. But our murder rate is 6 times higher than Canada and 20 times higher than New Zealand. Wow. What distinguishes the United States from those countries? They all have licensing systems. They have gun storage requirements where you have to keep the gun and the ammunition separate, for example. You have to get a training certificate to purchase a gun, and handgun ownership is not permitted for personal protection. So we could do all of those things to make our guns safer.
You know, it fascinates me because you just made a comparison between the gun industry and the tobacco industry, maybe, let's say, prior to the 1970s, shall we say, when it wasn't very much regulated either. And so I don't think any of us that were around in that time would ever have thought that we would have come so far in the social and political change with respect to tobacco, which is one of the most preventable forms of disease. And many countries around the world, the developing nations, China and other places where the smoking rates are very high, are going to see just an enormous burden of disease going forward. But that change did happen here.
Some of the best evidence that I've seen comes from Australia, which in many respects is very similar to the United States. It's a gun-loving country. In 1996, there was a massacre in Australia where 35 people were killed by a man who had a history of mental health issues and violence, who obtained a gun and went on a rampage. As a result of that, Australia just completely reevaluated its policies and instituted a couple of policies. One was a gun buyback program, and the other were these sensible regulations that I mentioned a minute ago. And if you compare the trend in homicides in the United States versus Australia, starting with that point, Australia drops dramatically. The U.S. is also dropping, and we shouldn't forget that. But the gap between the two countries was rather small before 1996. After 1996, it's diverged very radically.
Can I step in?
Please, Pastor.
Because there are so many amazing and wonderful things we could do in manufacturing to make it safer. But the reality is, we're not really talking about the gorilla in the room, which is the gun industry and their incredible power. We can't pass background check legislation. And so the idea that we could push forward to safer guns right now is unimaginable. I do think, though, using the analogy with big tobacco is a good place to start. Because with big tobacco, we went from having about 45% of Americans smoking in 1953 to now it being under 20%. And we did that by attacking the issue at every level in a multidisciplinary approach and got it done. The issue we're facing now, though, is that the gun lobby is far bigger and more powerful than big tobacco ever was. And I think it shows us the magnitude of our work when we recognize that, we never would have seen a Senate Majority Leader publicly vowing not to even consider confirming a Supreme Court nominee that wasn't approved by R.J. Reynolds. But we are now seeing Mitch McConnell very proudly vowing that he will not consider confirming any Supreme Court nominee that isn't approved by the NRA. So that shows how big the opposition is and how hard we're really all going to have to work.
I think we would like to tap into some questions out here in the audience. And I know we have some cards, but if you don't mind, I'm going to walk out here and see if I can get some of you folks to ask a question or two of our panel, and let's get a discussion going. Who's first? Right over here.
Hi, thank you all for a good discussion. So my name is Alicia Leisinger, and I work in tobacco control, and I'm the industry, is so reminiscent, and the NRA's power is so reminiscent to me that I had to ask a question about their tactics. So one thing in tobacco control that we see so often is that local governments are limited by preemption. And does that exist and can you talk about that and like what possibilities are there for local regulation?
Great question. What can we do to prevent preemption?
We have preemption in Minnesota right now. So the city of Duluth passed a gun violence prevention measure, and it couldn't go anywhere because of preemption.
Okay. Let me go over on this side. Question? Mr. Bence.
So many people think that gun ownership is protected by the Constitution, and so there's no even place to start with any restrictions. So we were using the analogies with big tobacco, which obviously that didn't apply. So how do we come at this issue, given that that's an overriding concern?
And that's an interesting thing because constitutionally, even the First Amendment is not absolute. Judge?
Yeah, but the Second Amendment's pretty darn close. That's just a commentary. No, but I think that that's obviously a difference, and I'd like to know if the comparison with Canada and Australia and New Zealand holds true as far as their constitutional protections regarding gun ownership. I mean, the Second Amendment talks about a well-regulated militia. That's been something that has been written about kind of ad nauseum, but I am but a state court trial judge. I must follow the Court of Appeals, the Minnesota Supreme Court, and the U.S. Supreme Court. So what they say the law is, I need to salute smartly and follow that. I can distinguish things if I think if it's distinguishable in good faith. But I mean, the truth of the matter is that our courts have said that the well-regulated militia goes down to individual gun ownership. It's not something that it has to be an organized group of, like a militia, a state militia. Because if you go back to the early days, the thinking is that the militias were made up of individuals. They were people who banded together as gun owners to protect their land or their property in other ways. That would be a sea change, and that's something that's going to have to come from the U.S. Supreme Court in order for that to change what the views are with regard to the Second Amendment. And if that's what Senator McConnell said, that's probably why he said it. So I think we have to deal with the reality that legally it's not going to be something where the government's going to be able to take away individual guns. And it might be something from the public health perspective, to pick up on something the pastor said earlier. It's a matter of finding those commonalities with the NRA and use their power to advance the public health agenda, as opposed to always being at kind of loggerheads or being an us against them. And I think if you appeal to individual members of the NRA, I'm kind of an anecdotal guy. I don't have all the studies and everything else. I like to read them, but I don't remember all the numbers. I remember kind of the broad messages. And I've read enough studies that talk about individual gun owners who are members of the NRA who don't support the NRA's position on this. And so from a grassroots perspective, from a local perspective, it's a matter of reaching out to those local members and saying, okay, you're a gun owner. What are your personal concerns? And do you share the concerns with the public health community about the suicide issues, about mental health victimization, about chemical dependency issues? And how can we work locally to get the people who are in the NRA, for instance, but any public
I
group,
think we're talking
start
about that
advancing
tried and
that.
true jurisprudential principle of reasonableness.
Well, I think also we've never claimed the Second Amendment, and maybe we should. Maybe if the GVP community were saying, we know that we have the right to bear arms, we're not trying to take your right to bear arms away. We want to regulate it. We want it to be well regulated.
Okay, another question right here.
Yes, D'Amica Kilgore. I'm a hospitalist at Regents Hospital in St. Paul. And so my question has to do with the research approach. And so have there been any thought of like research proxies or data proxies outside of death by suicide that can be used to collect data? Maybe hotspotting, things of that nature.
I think we missed the last sentence.
Data proxies.
Yeah, so instead of measuring guns, measure something that would accommodate or
It's like
assimilate.
measuring guns and ammo, the magazine, right? Is that a
There's
possibility?
private groups that are doing real research. Everytown for Gun Safety, Michael Bloomberg's group, he's poured a lot of his personal wealth into doing serious research, and he's free to do that. And so we're really lucky right now that we do have some national GVP organizations that are doing the kind of research the states can't do.
Okay. Oh, other question right back here.
But if I could just address that question also kind of differently. I mean, that is the real problem that I think a lot of people would recognize is there isn't an adequate kind of measure other than looking at guns. And the funding for the Centers for Disease Control, or even the Institute or the Justice Department, looking at gun violence, the funding has dried up. And so if it's something that the mental health professionals or public health professionals can get funding to look at it kind of sideways, that funding could be available. But I think direct investigation of gun violence or gun ownership, and if you have the word gun in it, it seems to have a real funding problem.
Okay, my question is, how do you build coalitions across all the different groups that are affected by this gun violence? Because here we're all public health professionals in some way, and we understand everything you're saying, but what of people who don't really get how policy affects gun violence? People who want to make it maybe about race, people who want to make it about maybe particular ethnicities. How can we get everyone to work together to be able to achieve this?
Well, I can certainly say that what we're doing at the city level is trying to work across the city of Minneapolis to really help people see that what's good for one is good for the whole community. And so we're fortunate that Mayor Hodges has really been focused a lot on disparities and assessing the fact that when one of us is hurting, it really impacts the broader community. So for example, when we think about public safety and we survey annually about public safety perspectives or perceptions, about 85% of Minneapolis residents claim that they feel safe in their community, but we see significant deficits in near North, Camden, and East Phillips. And so from the Youth Violence Prevention team, about all of our youth violence initiatives, but certainly as we think about gun violence, we really take a concentrated approach in working with those communities, but also educating the broader community about how gun violence and violence in general can spread as an epidemic spreads. And so that's the approach that we're taking locally.
You mentioned the near north neighborhood. I pulled together some crime statistics from the near north in the month of January of this year. And January is usually a pretty low crime month, but there were 192 crimes in the near north area. If you blow that up to a whole year times 12, That's 2,304 crimes in that one neighborhood. There's only 31,000 people in that neighborhood, so that works out to 74 crimes per 1,000 people. If you just live up there for a few years, you're likely to be a victim of crime. Okay, I'll get to the point now. Studies have shown that housing values in a neighborhood fall when there's high crime. At that rate of crimes on the north side of Minneapolis, it seems like the houses there shouldn't have any value at all. It's just horrendous. So if the city wants to attack the problem of development in the neighborhoods, or the lack of development and the blightedness of some of our neighborhoods, the best way to get a handle on that is through reducing the crime rate. Just going out and investing money in a neighborhood is not going to cut it until the crime rate comes down. But if the crime rate comes down, then you've laid the groundwork for the investment to follow. So that's how I would try to sell the issue. It is one in which you want to help the neighborhoods of Minneapolis develop, and the way to do it is to cut the crime rate.
And if I could address it not from a criminal justice perspective, but you asked kind of a practical question, how do we get more people involved? And this might seem simplistic, okay, and I don't mean to make it seem that way. But if you're a member of a book club, get a good book that talks about gun violence. If you're a part of a church or whatever, actually talk about it with people that you're close to, people that you have trust built up there, and start the discussion. It's just like with mental health issues. If someone knows someone who has a mental health diagnosis, they're much more free to talk about that and feel comfortable talking about that with their peers, and then it removes the stigma. You know, gun ownership or gun violence is it seems like it's a very third rail issue. You don't want to touch it. And I think if you actually just have a reasonable discussion and say, hey, this is something that I've been thinking about. I was at a public health conference and we were talking about this, and we were wondering how we can get more people outside the public health community talking about it. You know, talk to your neighbors. I mean, whatever you do generally, you can introduce the topic. I remember, might seem too off topic, but you know, as a parent, I remember the first time my oldest child went off to a sleepover. And my wife and I were talking, and we said, you know, they seem like a very nice family. We don't have guns in the home. I didn't grow up with guns. Nothing wrong with it, just wasn't what we did. And I said, I wonder if they have a gun in the house. And my wife said, well, I don't know. Like, how do we find out? I mean, like, what do you do? And I was involved with our elementary school PTA at the time, and I said, I think we need to start a discussion. I think we need to say it's okay that parents ask other parents if their child's going to be over there, do you have a gun? It's not something you have to talk about in front of the kids, but it's something as a parent I would want to know, and I'd want to know that the gun is secure. And so, you know, I called up that family and I said, this might seem awkward and it might seem out of place, but you know, I need to know. And they told me, and they did have a gun, and they had a safe, and they talked about that, and so I felt okay about that. But then I could talk to my child about, okay, now if you're over there, if someone brings out a gun, you can have a very discreet conversation about what to do and what not to do. And so if you have a child who's in school, talk to your PTA, talk to people about, or teachers, about how can we increase the discussion so that people feel safe talking about guns.
I have a question over here.
Hi, Matt Sepik here from NPR News. Thanks for the shout out, Judge. Speaking of the citywide crime statistics, I just happened to look at the latest numbers from the MPD, and they are now, by the way, at least as of the last couple of years, reporting the number of gunshot wound victims on a regular basis. And I've noticed in the first quarter of this year, it's nearly doubled over the same time last year. And I guess this is a question for Sasha. To what do you attribute this upsurge in shootings? I mean, number of homicides is relatively flat and low, thankfully, but a lot of people getting shot. What do you think is the cause of this?
So thank you for the question. It is something that I can't speak to all the numbers, but I can speak to those numbers under the age of 24 because that's really the demographic that we focus on. And the largest number of gunshot victims are generally our Minneapolis residents 18 to 24. And we are seeing a national trend with that uptick. And our numbers, while they are increasing, have not increased as significantly as some of our other cities. You know, there's a variety of factors that we could look at. I think one of them, particularly for young people, is there is some thought being paid to the sentencing guidelines, to be completely honest, and that people are making some concerted efforts to maim and not murder. You know, that's what we're hearing on the ground, and what we're hearing young people report that they hear among their peers is that it's to some degree strategic. We did have a site visit from the federal government, and we've looked at our shot spotter. It's kind of a tricky word to say. And some of it is bad aim, you know, is what we've been told as well, is that young people who aren't familiar with handguns or how to hold them or how to use them sometimes just don't know how to hit the mark. And so in some ways, we're lucking out, but in some ways, you know, we had a recent homicide over the weekend of a young man who was reported as an adult, but who is an 18-year-old. So for those of you who are parents, we know that nothing happens magically when young people turn 18, and that he is still a young person whose life was taken by gun violence. And so we are constantly looking at ways to address that, but it is a national uptick.
Ladies and gentlemen, please thank our panel for being with us tonight. I want to conclude with a thought or two, and then I'm going to hand things back to Shruti. And the thoughts I have really have to do with keeping in mind, again, what public health approaches are all about. So we've talked a little bit about some of those characteristics, and I want to remind you what some of those definitions are. And almost every one of our speakers has alluded to a key aspect of what a public health approach is. So, it's the science and art of preventing disease, prolonging life, and promoting health and well-being through organized efforts and informed choices of society, organizations, public and private communities, and individuals. So public health is about all of us. It's not just about the agencies that we have in government or the NGO organizations. It's about all of us. And I don't know that there is any public health issue that isn't political by its very nature. Politics to me is not a dirty word. Politics is how we get things done based on the values that we hold and on the vision that we want for the society in which we live. It's not that we have total consensus on that all the time, but ultimately there's got to be some core values, and you organize, and that's how this stuff works in the area of public health. So with that little sermon, thank you very much for being here, and I'm going to turn things over to Shruti.
Thank you, Dean Finnegan. I just want to thank all our panelists and Congressman Ellison for coming here and speaking to us. It was a great conversation and much needed by, or wanted by the students in the School of Public Health, so thank you again for attending. The event today was live streamed on YouTube, and the link for the recording will be permanently up on our website, and it should be on the program that you can pick up as you leave. So have a safe trip home, and good night.